Hello, my name is Joy Ashby Cornthwaite, and I have Klaus Madsen with me, and we will be our hosts for the 26th episode of the live stream show, MyDiabetesHQ Live. Hi, Klaus.
Hi, Joy. How are you?
I'm well. Today, our guest will describe how a survey of local health status informed a county initiative to change obesity for its most vulnerable members. Pasadena, Texas's Safe Routes to School initiative has become a part of the fabric of that community, serving to improve obesity and chronic disease risks for children and their families. Even during the pandemic, the program has continued to thrive, providing much-needed physical activity, a small reprieve, and some sense of normalcy, especially for the children. Stay tuned. Today's episode is coming right now, and you don't want to... Just a gentle reminder that the content shared during the MyDiabetesHQ live broadcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding diabetes and any disease. You want to begin, Klaus?
Sure. We're so excited to have all of you here with us today. And before we go into learning more about Healthy Living Matters, Pasadena, about the great successes that you've had, not just in Safe Routes to School, but also having a community coalition that have endured all kinds of challenges over many years. I'd like to ask Raul, what's it like to live in Pasadena? Can you describe your community?
Yes, thank you. Pasadena, basically, I looked at it back in 2000. I was living in Houston, and what brought me to Pasadena was, in actuality, the district had a very good quality, has a good quality school district. And the location to close to my job, close to my friends and some of my relatives that lived in Houston on the East End. So that's what I really brought me here. But then I noticed that there was definitely some challenges in our community that needed to be addressed. And that's why I got involved in trying to make change in our community to improve the quality of life. And we're moving there and getting there. So eventually we will be another community that could be at the same level as Pearland, as Katy. So we can have all those amenities that the community really cherish and are able to utilize in our city. So we still got a lot of work. It's a good place and a great place to live and work and worship. And so that's why I have been here in Pasadena for 20 years, and I'll probably stay here for the rest of my life because I see a lot of improvements, and we are moving forward with these, especially with the impact that we're having with these initiatives in our community.
That's great, Rose. Thank you so much for sharing your enthusiasm about Pasadena. We'll put it on our travel bucket list from now on. You have made all these efforts through Katy Chennisi with Harris County Public Health, and Joy and I have really enjoyed working with Katy over the years. She was integral to developing the Faith and Diabetes program in Cities Changing Diabetes Houston. We created a prevention guide for obesity and diabetes prevention in houses of faith with Harris County Public Health and Houston Health Department, and it's just been a joy to work with you, Katy. Thank you for being on the program also.
Oh, you're very welcome. And likewise, a joy to work with all of you guys as well.
And so in public health, a lot of times we start our work when a community member raises an issue, or when we look at particular data. And you've worked with Dr. Stephen Linder with the UT School of Public Health, just like we did in both Cities Changing Diabetes Houston and Cities Changing Diabetes Philadelphia. How was it like to work with Dr. Linder's data in Pasadena? What did it tell you about the community?
So when Healthy Living Matters first started in 2011, they knew that they needed to take a data-driven approach, or we weren't going to get attention from the people that we wanted, whose attention we wanted to get. And thankfully, around that time, Dr. Linder and his team had just published the 2010 iteration of his Health of Houston survey data. So we relied very heavily on his information, on the data that he was able to get about childhood obesity. And it helped us pinpoint certain communities in Harris County where the rates of children who are overweight and obese were so astonishingly higher than in other areas of our county that it just made so much sense for us as a health department to try to go into those communities, engage stakeholders, engage the community members, talk to the right people and get them on board so that we could have a collective impact approach to trying to prevent and reduce childhood obesity. And so as you could briefly see from that map, Pasadena was one of those communities where we would see rates of like 55% or higher of children who were overweight or obese. And we knew that that was unacceptable. So thankfully, there were people in that community like Raul that were already dedicated to knowing that, the health of our children is important. And if we don't do something now, we're not going to change it. So we do appreciate having partners like Dr. Linder that put the effort into getting us that really rich and robust data, because without it, we couldn't make a case as to, why we wanted to work in that community.
That's excellent, Katy. I love the idea of, and we all understand the importance of backing up the things that we want to do for our communities with important information, and then combining that with the enthusiasm of residents like Raul and in the city. How do you then, get other people on board? Right. So you've got the public health system saying this is necessary, and you have Raul saying, I want to live, work, play, worship in my wonderful community. How do you get the parents on board to say, look, this is something meaningful?
So I can start answering that from like the stakeholder perspective, but then I would love to hear Raul's opinion as to why from a community member he thought it was important to get involved. So we began our journey in Pasadena in 2014. Mm-hmm. And the first step was to establish a community health coalition. So we branded it our Healthy Living Matters Pasadena arm. And we called all of the members our community task force, because we really wanted community to be at the heart of everything we did over there. So of course we engaged the usual players, the school district, the healthcare sector in Pasadena, the city, because obviously we are the county, but we can't make decisions for the city unless the city was involved. And then nonprofit organizations, community-based organizations, and community members. We knew we had to have community members, which thankfully a lot of our stakeholders also reside in Pasadena, so they were able to wear both of those hats. But it was, first, reach out to them, provide them with the data, tell them about, the importance of working together to address childhood obesity from a policy, systems, and environmental lens, because we knew a lot of other partners were doing programming, but sometimes programming doesn't get us far enough. We really needed to address policies, systems, and the environment, which is where Safe Routes to School clearly falls within. But it was a struggle. It was a struggle being new to the community and having to gain the trust of community members. It was a struggle trying to present to community members what the data is showing in a way that it wasn't insulting or it wasn't attacking the quality of life in Pasadena, because that's a very personal thing. They reside there, they love that community. And when you come in with this approach of like, look at what these problems are in your community, you're not always going to get the best reception. So it was a lot of building relationships and building trust and listening to the partners like Raul, like our partners at Pasadena Health Center, at the school district, at Baker Ripley, that said, hey, these are the groups you need to approach. These are the people you need to talk to. Don't host your own big events, partner up with us and we'll do it together because they know us, they trust us. And that's how it happened. And it's taken, we've been out there for 7 years working with that community. It really did. It was a learning curve. It was a humbling learning curve of like, nope, you can't just come in there and tell people what to do. It's a process. So I would love, Raul, if you want to take it on from there. And from a community member perspective, what was it about being a part of that effort that you think, brought value to your life?
Well, one is because I live here in the community, and I had a personal a connection to this initiative because I was having challenges with diabetes, obesity in my life. So I needed to learn, okay, where did I go wrong? So I needed to understand and see, awareness is the biggest thing. Is I became aware, why did I get to where I am at today? And then from there, once all these agencies and organizations came together in this coalition that Healthy Living Matters created partnerships so they can share in their knowledge and expertise with the community so we can understand, okay, now we understand how we got here. Now what can we do to change that perspective, change our future, because it was very important, especially for our kids, because they're our future leaders, they're our future everything for our community. And if we don't change the trajectory of what we've been doing in our culture and our community, we're not going to be a healthy community to be productive. So that's why I became involved, because I was personally it was a personal issue for me, and I wanted to see how I can make a difference in the community and be a champion and let everybody know, hey, this is what's going on. This is what we need to be aware of, and this is what we need to solve. Some of those challenges we have in our infrastructure, in our community, in our city, what we need to change our habits. What we need to do, we need to work with the school district, with the city, Pasadena, and these organizations that are willing to come in and help us achieve this goal of becoming a healthy community. So, yes, that's why this coalition, this Healthy Living Matters that came through I think it was 2013 is the initiative that towards the end, and I came on board at the beginning of 2014. And I've seen a lot of change and inroads with the city, the school district, and our community, and we're going to get there very soon.
Excellent, Raul. I wish all communities had a Raul who would be a strong community health champion. It's so important to reflect on your own personal life and when you see things that you can change in your community, do something about it, and find allies, your neighbors, people from the local school board, PTA, other members of the community. So that's really inspiring. I think it would be great for Katy and Raul. Katy Oestman, who's also on the broadcast with us today, to talk about how you got to defining Safe Route to School as one of your obesity prevention strategies, and also define what Safe Route to School is.
Absolutely. And I can start from the Healthy Living Matters perspective, but then I'd love to turn it over to Katy Oestman from a Pasadena Vibrant Community perspective and share a little bit about that. So with Healthy Living Matters, before we even came into Pasadena, we already had a set list of policy priorities that we knew if we could get our partners to help us advance those priorities, we would make a difference in the lives of children. And safe routes to school was one of those priorities that we had identified because of its evidence base, because we knew that so many children lived within a half a mile radius from their elementary and middle schools, but we were seeing less and less children walking with every passing year. So when we came into the community of Pasadena, we proposed all of the HLM policy priorities to our partners. And every year we asked them to prioritize amongst our eat priorities, our play priorities, and our learn priorities. And every year without fail, safe routes to school rose to the top. They felt as a group, as a community, that if we could get more children to walk and bike to school, we could increase the number of kids who are physically active, we could reduce congestion, we could improve the built environment, hopefully get the city's attention to install or redo some of the sidewalks, the crosswalks, things like that. And thankfully, we had a willing partner, which was the school district, that said, you know what, let's try it out. We think it's a great initiative. We think, our schools, we have a couple of schools that are ready and poised, because in Pasadena, there are certain elementary schools called neighborhood schools that don't have bus routes. So the only way children could get to school would be to either actively transport themselves there or be dropped off by a parent, family member in a vehicle. And they were seeing so many lines of traffic because most parents were dropping them off in the vehicles and, congesting major roads. So that's why the school was like, you know what, maybe this could improve some of that. So why don't we test it out? So we started testing the waters around 2015, 16, more or less, started with one willing elementary school that said, okay, let's host a walk to school day event and we'll see how it goes. But you guys need to help us tremendously along the way. You need to find the safest route. You need to get us the volunteers. You need to get us yellow vests so that everybody's very visible and safety is the number one thing. Get the support of the police department. I mean, pretty much do it all. And then we'll promote it to our students and families. And that first event, 2016, as you'll see in the timeline, we had over 100 people participate. And that was that indicator that said, you know what, we can do this. We can make it broader than a one-time event for one school. And that's where Katy Oestman and MD Anderson and the awesome support of Pasadena Vibrant Community comes in, because they said, we can take it to the next level.
Thank you so much for setting the stage, Katy. Hi, everyone. Thanks for having me today. My name is Katy Oestman. I am an employee at MD Anderson Cancer Center, and one of the main programs that I work on is Pasadena Vibrant Community. And Pasadena Vibrant Community is an initiative of the University of Texas MD Anderson Cancer Center, sponsored in collaboration and sponsorship with Shell Oil Company. And so we formed a coalition to complement the work of Healthy Living Matters in late 2016. And so as Katy stated, Safe Routes to School is one of the premier programs that we, along with the steering committee, decided to fund. Safe Routes to School is a Centers for Disease Control and Prevention high-five intervention. So that means the CDC came up with a list of interventions that they knew would make a big impact on childhood obesity within 5 years. And so knowing this information from such a trusted source as the CDC, we thought this is a great thing to fund. And we knew that one of the main important things to do foundationally is to create a Safe Routes to School plan. And then you can apply for a lot of the larger federal and metropolitan planning organization funding streams if you have a solid plan in place. And so Pasadena Vibrant Community, along with Katy Chennisi at the health department, as well as our partners from the school district and the city, formed a really tight action team. And we met about every 2 weeks for almost a year. It was a really long time to put together this Safe Routes to School plan. And we had a tiered approach where we assessed the schools, and it was a very robust process. And at the end, we had a beautiful plan, and the health department designed it really well, and it's on their website if you'd like to take a look. And so we just knew that there was lots of groundswell and momentum with the One Walk to School Day, and we knew that we could help make a difference and help get more kids walking if we had a solid plan, and then we could help the city apply for funding and also be able to redirect some of the existing resources that they had to be able to make small changes, which would make a big impact in uplifting the pedestrian environment for not just kids, but for their parents who need to walk to places like the supermarket and to local parks. And so we were so glad to support that and to help foster those partnerships with our key players in Pasadena. I don't know if we're taking questions or if there's anything else that I can answer at this point, but
yeah, I have a follow-up question. Thank you, Katy. So how has transportation changed in Pasadena? How many parents are walking their kids to school? How many kids are biking to school that didn't do it before? And have you tried other things like the walking school bus, which is a really cool concept? There's an adult that goes through the neighborhood, and all the kids join the adult, and they walk together to school. What are some of the features of Safe Route to School in Pasadena?
So one thing that we did with the school district when we started Pasadena Environment Community was to track which interventions were going on in which elementary schools. And there are 36 elementary schools in Pasadena ISD. And so their Healthy Schools coordinator was able to track the number of interventions, Safe Routes being one of them, and subtract the number of walkers and bikers at each school. And so when they started tracking in the end of the 2017 school year, so in spring of 2017, and the walkers were in about the hundreds within each school. And then what we've seen by this last year, of course, pre-COVID, was in the thousands of children walking to school. And this may not be children walking to school every single day, but the trend was definitely increasing across the 36 elementary schools of children walking to school. So we were glad that we keep evaluation top of mind, and we're tracking those important interventions and walkers as we're continuing with more interventions and doing more on Safe Routes to School and hosting more than just one event per year at the schools.
Right.
I think to add on to what Katy mentioned, the other thing that the school district has been extremely strategic about is embedding Safe Routes to School into their policies. And so one policy is they have a campus recognition that they do for their PE and wellness efforts. And they've embedded Safe Routes to School and hosting either a walk or a bike to school day event as something that will earn each campus additional points towards that gold, silver, or bronze recognition that they provide them with. So already campuses at the beginning of these efforts really were like, it sounds great, but not for me. Now are more motivated to be like, oh yeah, we need to host that event because we'll get those additional points towards our, recognition or challenge. So it was just another very clever way of the school district to say, you know what, we're going to embed this into our culture. And not only that, but also in the PE teacher professional development. Every year they give us an opportunity to present in front of their PE teachers during one of the in-service days and just share that additional information about the importance of Safe Routes to School, how they can get involved, and highlight the efforts of those schools that are currently doing it and being those champions. So it's been a very strategic way that everybody has just kind of supported each other with these efforts.
Yeah. And so, y'all, what I'm hearing is that it was a very layered approach, right? So get the community members in, get the community to understand that it's something that they can do to increase their health and improve their community, and then add in the layer of MD Anderson to help with the funding. And then on top of that, come back to the school district. And that answers one of our questions from one of our viewers that said, $1 million question, how do you get the district to partner with you? Noticing that this is something that's good for their community and then layering it and embedding it. And so this is a really long process. Do any of you want to kind of share what drives you to continue to push for this? Because this is a labor of love for each and every one of you.
So I will start, and I would love to hear from the other folks on the line. And I'm glad I see Tim Schauer here, because I'm going to go back to something that he presented on last week, I believe, or a couple of weeks ago. And it's really the involvement with the School Health Advisory Committee. We were very fortunate. So Pasadena Independent School District has a very robust, well-attended school health advisory committee. And we have been involved in that SHAC since our involvement in Pasadena, because we knew that was the way to get the attention of the school district, to get to parents, get their feedback. And we had heard, parents were already talking about the importance of safe routes at those meetings. So we don't want to in any way, shape, or form take credit that we came in and we were the first people to talk about it. But there were parents that were literally talking about their concerns about, high velocity on the streets around the schools, the need for things like speed bumps and traffic calming measures. And because of the voice of those parents and the attention of the SHAC, and then the bonus was just, Katy and Pasadena Vibrant Community coming in and us coming in and all saying the same thing, but in different ways and adding different layers, that we feel that it has been as successful as it has been. And I think when you get up at 6:30 in the morning to attend one of those walk or bike to school events, it makes all the difference. That's why you want to do it forever and ever and ever, because the kids, the joy on the kids' faces, the parents saying, wow, this was so much easier and nicer than I thought it was ever going to be. We just hadn't even thought about it. And then the teachers and the principals saying, this was a lot of fun. Can we do it again? I mean, it's worth it just because of that.
I love that line, that picture at the top right-hand corner where all the kids are coming in, and then, the kids, the guys on the bike. I mean, I have a kid myself, and just walking them to school was always a pleasure. It gives us that moment of calm, and it also helps with their attention, right? So I intentionally walked with my little one, especially in his earliest days in pre-K 3 and 4, early in the morning, in order to kind of get it out of his system and allow for him to sit and pay closer attention. Is that something that the teachers are reporting, or that the school is reporting? It's just a question that I just thought of. So
I could take this. With Pasadena Vibrant Community, we asked the school district if they would be willing to track attendance and discipline. And so they have been tracking that across the past 3 years. Now, we haven't done an analysis yet, but, and of course, we do not fund research. And so this is not a research study, but it is, of course, anecdotal, looking at different correlations between interventions on things, on outcomes like attendance and discipline. And so we're hopeful that in the next year or two, we can work with a researcher to really dig into that data a bit more. But anecdotally, we heard great things from the teachers, from the increased number of kids that were walking to school, just on the classroom environment and how the kids were behaving. Once they got there, they were a little bit more chilled out since they had their walk to school. And I just wanted to share my experience. And so when Katy was saying you get up at 6:30 to go, she means you arrive at the school at 6:30. So it's early. Elementary kids start super early, but it's always fun. And what makes it so rewarding is when you see their little heads poking through the cardboard school bus in the morning. The early bird gets the worm. They get to hold the school bus as they're walking. It's just priceless. There's just nothing like seeing their little joy when they can be the ones to hold the school bus. And then when we, give them a sticker. Yeah, so it's very sweet. We were really glad that we could fund several of the school buses so that schools could check them out from the PE program and just have them so that kids find it very fun to have that picture taken with it and whatnot. So that's been really rewarding. And I wanted to back up just a minute and talk a little bit more about our relationship with the school district. And one thing that we when we first started working with Healthy Living Matters, and what they're very attuned to is not telling people what intervention they need to do, but working with them to get them to a point that they're identifying the intervention and wanting to implement it, and we're simply helping. So we didn't come in saying, oh, we have funding to do safe routes to school, we're going to go ahead and do that now. It was much more of a collaborative approach. And so it was great that we could Katy had a lot of foundation to build with the school district. And so we just built on that and we're able to provide a few more resources. And so when we did approach the school district about formalizing the project, they were all in.
And also, I wanted to make a comment on that. What Katy had mentioned about the school district. That's, like I said before, when I first started at the beginning of the conversation, was the reason I came to Pasadena was because of the school district, because they have a great school district. And unfortunately, they were siloed with these issues. And when the coalition came in with Healthy Living Matters and created this coalition and brought in Pasadena, a vibrant initiative with MD Anderson and all these stakeholders, it took off because the need was there. The hunger for the community was there. We wanted to make a difference. But one of the biggest impacts that I see, that the biggest stakeholder that can make the biggest impact in our community, is the city of Pasadena. And unfortunately, they lagged, but they have been listening, and they are starting to adapt, and they're incorporating. And a lot of the work of the Pasadena Vibrant Initiative and HLM, Healthy Living Matters, has transferred to the Parks Department. They've come up with now their Pasadena Healthy Parks Plan, master plan, that they started in 2019. So we're seeing this coalition and how everybody, we need to stop being siloed and all come together as partners and work together to solve a lot of our issues and improve our quality of life. So that the school district was just siloed, but when everything came together, all the partners put HLM put the coalition together, it just has been growing and growing and growing every year.
And Raul, I'm so happy you talked about the Parks Department and the Healthy Parks Master Plan, because it truly, you can see now how, because of our, very rooted partnerships and collaborative, mentality, all of our plans complement each other. And so when the Parks and Recreation Department embarked on that work for their Healthy Parks Master Plan, they made sure to take a look at the Safe Routes to School plan to see where those connections lie. When the city embarked on their Livable Centers study, they also used the Safe Routes to School plan as a guide, because they knew, we already did the legwork around areas that needed to be more walkable and bikeable, and let's just integrate that into this other big effort that we're doing, so that, as Raul just said, so that it wouldn't be in silos, so that all of these entities that have been working together for so long were leveraging each other's plans and reports and hard work, so that it would be a seamless, we're all saying the same thing, we're all recommending the same thing. We just have all these really great tools and resources that we can pull from. So that's been really great to see.
That was go ahead. Katy,
I was just going to say, one of Katie's colleagues at the health department, Amy Schultz, is in their built environment unit, and she worked really hard to help sit down with the city and help them understand some of the engineering recommendations. And although they wouldn't call what they do Safe Routes to School, we're among friends and we can call it that, but they made a lot of improvements along one specific street, and they integrated everything that Amy had worked with the planning and engineering department to tell them. And she spoke their language, and she helped them see how the recommendations can fit into what they were already doing construction-wise. And now the street is beautiful. It's pedestrian friendly, and it's just such an augmentation for the pedestrian environment and for everyone in the city who's able to use that street. So we're just learning how to speak other people's language in terms of what they call things. And if they don't ever want to call it Safe Routes, that's fine. We can, and we know that they are allies and partners in it.
It's great to see how you all are breaking down silos, not just between sectors, but also within government, having city and county priorities and actions aligned is just tremendous. I'm so excited to have Tim Schauer back on MyDiabetesHQ Live. Welcome, Tim. You have worked as a lobbyist, and you have a special role serving as an external consultant to Harris County Public Health around health living matters. and I really see you as a grandmaster of that proverbial multi-level chess game where you have local policy, you have state policy, and then the last chessboard is the federal policy, and any move that you make influences the other chessboard. So Tim, can you talk a little bit about how you are getting inspired by working with residents like Raul and leaders like Katy and Katy? How does that inform the work that you do in Austin through the Partnership for Healthy Texas and at the state capitol?
Yeah, thanks, Klaus. Great introduction there, and good morning, everyone. Thank you for allowing me to come back. It was actually Halloween when I was on here. We were talking about advocacy, so it's good to be back. But really, the important thing that I like to talk about when people get wrapped around the axle about, oh, he's a lobbyist or he's working on policy, and people don't quite understand that, basically a system gives you exactly the results that the system is designed to give you. And for those of us 10 years ago that started realizing that and for some of us, it was 25 years ago, started realizing that our system, and I mean by system, our communities, was generating an outcome of tremendously obese children and tremendously obese families, you have to start looking at that system and saying, if this is the outcome we're getting, how do we change the system? And I think it's a great analogy, Klaus, to the multi-level board. But the most important level to me on that board is the local community. And the reason why I emphasize the school health advisory communities and the SHACs so much, because they are in the local communities. They know what are the most important things to start changing the system, and they can start working on that. Now, what they often run into is funding problems, restrictions, rules or regulations, laws that are at the state level or the federal level that have been oftentimes unknowingly. I don't think anybody woke up 30 years ago and said, hey, let's design a bunch of laws that make people obese. I don't think anybody did that. I think it's the unintended consequence of doing some other things and changing some transportation guidelines and changing some functional rules, and quite frankly, some of it was cultural. Back 30 years ago, nobody even imagined that we would have these things in our pockets and that we could literally access all sorts of information, all these things, and we could get a ride to come to our doorstep anywhere in the community and get driven anywhere, right? And it's a beautiful thing if you've got to go somewhere and you're in nice clothes and it's raining, right? But if you don't need to drive, if you can walk, if you can get some exercise, these are things that we need to be reinstalling into our communities around that organizational principle of eat, play, and learn, right? And that's been the whole guiding principle of what Healthy Living Matters is all about, and we've been doing it. So the important things to me is that we understand what's happening at the local level, because once you understand that, then you can help guide decision-making at the state level, and you can understand what are the policies at the state level that are either impeding our ability to make good change or could be tweaked to make better change. So, for example, this upcoming session, we're still going to be fighting to get recess policy reestablished in this state. And we're going to be fighting to get some PE, expand the PE requirements. We're going to be fighting to reestablish health education as a requirement in the state of Texas. It's amazing to me that school districts have the flexibility to not do health education, to not have recess policy, to literally have a minimum participation of physical education for our children as they move through the ages. So those are some of the three big agenda items that we're working on this coming session again at the policy level. But we wouldn't have known those things if it wasn't for working with Katy and the communities and finding out that in some of the schools, they literally had zero recess during the day. And I got to tell you, my memory is long, and I recall my elementary school days, and I would have had to be heavily medicated if I didn't get recess. I'm just one of those people that has high energy. I need to move around. And if I mean, literally, I feel like I've been, during this pandemic, like I've been punished, horribly punished, because I'm in my house all day long. So I get out, and about every 2 hours, I go for a 10-minute walk through the neighborhood if I can. I drop and do push-ups. I just do something, because I can't fathom sitting in a chair for more, quite frankly, than about an hour. I even have it my stand-up desk so I can pop it up when I'm moving. So the importance of policy and learning from the local level and then translating it up to me is really key, and that's what I do with the Healthy Living Matters folks.
Wonderful, Tim. Thank you. Are you seeing some of the leaders from Healthy Living Matters going into leadership positions in the SHAC, on the school board, city council? How are you seeing Healthy Living Matters as an avenue to a more formal leadership position for some of these community residents in Pasadena?
That's a great question, and I might want to throw that to Katy, because Katy's on the front lines of Pasadena. We've done quite a bit of activity within Healthy Living Matters of training people and bringing people up to speed, and I really wanted to build, and it's still on my agenda, of building what I call the SHACtivist Academy, which is people who participate in the SHAC learn how to be activists. So it's not just about seeing what's going on in the school, but taking that and translating it further. But I'm going to throw it to Katy to talk about some of the specific examples of what she's seen.
Yeah, absolutely. Thank you, Tim. So with everything, and not just HLM Pasadena, but HLM overall, we want to make sure that our collaborative partners know how to advocate for change. And so at many different levels, including in Pasadena, we have provided capacity building opportunities around advocacy early on for some of our key stakeholders, so that they knew not only, that eat, play, and learn was very important, but how to advocate for change at the local and at the state level. So that was really important. The other thing is, with every meeting, and Raul can attest to that with our community task force members, we always encourage participation in those other systems that can create change. So encouraging everybody to be a member of the SHAC, encouraging everybody to attend, city council meetings, encouraging people to share with their networks, how the residents can advocate for change as well, whether it be, during census time, encouraging people to participate in the census, registering to vote, things like that. So that's always been on the forefront in every meeting, and we've been meeting monthly. Granted, now during COVID, we've had to switch to bi-monthly, but every month for 7 years, pretty much. And every meeting, there's always been that call to action, depending on what the situation is and what opportunities were available in the community. Because we knew we couldn't do it alone. And obviously we have limitations as government agencies. There's only so much we can do, but we want to make sure the community and our key stakeholders knew how to advocate for change at those various levels. So that's been really important. And thankfully, and one thing Raul didn't mention, even the community members that we've had as part of our local coalition, they are very strategic community members that have a lot of involvement in the community. Raul, when he first joined our group, and he still is, but very active member in his house of worship that also ran the radio station. So we had some very great, communication strategies there that were sent out through his, the radio station. Also an active member of various coalitions within the city. One of our other community trustees is a former city council member. So we were able to always better understand the internal workings of city council and how things happen there at the decision-making level, so that, she knew exactly when to present to city council, how to present to city council, what are they going to listen to versus what, just will go on, deaf ears. So, it's been very, and it wasn't like we were strategically trying to pull these people into our coalition. They just, through their own passion and will came on board, and we were able to find those, great connections to really learn how to best advocate for change within Pasadena.
I think it's so important to work together, and there are times when you feel alone as a SHACtivist or community health activist. You feel that there are really no other allies out there. But one of the things that fascinates me about Healthy Living Matters Pasadena is that you had multi-sector involvement from the get-go. You had you had Shell in as a funder of some of this work, and Katy Oestman, could you share how Shell has also helped engage policymakers in Pasadena? I imagine that when a mom or a dad goes to a council member and talks about an issue, they're listened to and they're respected. But if it's a major employer in the community, then that carries a different kind of weight or a different voice. So if you could speak to that, Katy, thank you.
Yes, certainly. So we do have a collaborative relationship with Shell Oil Company as our funder. However, they have stayed a little bit out of some of the policy. And so what we've done to still help to make a difference in the community where a lot of their employers live, the nearest refinery is in Deer Park, which is adjacent to Pasadena, is to make sure that where workers live is a healthy place to live and be able to access healthy foods and to be able to exercise outdoors and have those opportunities available to everyone. And so from an employment standpoint, we took that approach with worksite wellness, and we know that Shell is a very large employer, the school district is a very large employer, and so we've done what we can to stimulate worksite wellness through the district and just make things available to families and not just individuals.
Now, Klaus, can I share a quick anecdote?
You can share as many anecdotes as you would like, Katy. We love to finally have you on this show.
So I completely get your question about, making sure that the big employers and the large stakeholders also share their voice from a policymaking perspective. However, some of the quickest change I have ever seen at a city council meeting was when a group of 4th grade students were brought in, and a group of at least 10 of them came up to city council and said, hey, we noticed that our crosswalk is very faded and it's on the intersection of this and this, and we ask you kindly to please help fix that. And immediately the mayor was like, we're getting that done. No questions. So I understand the weight behind, the big corporations and the investors in the community, but I'm telling you, I have never seen a quicker response than when they brought in those 4th graders. And in my mind, I'm like, we should have been doing this every city council meeting.
Talk about stakeholders, Katy. Anecdotally, I had one of my daughter ran for student council in kindergarten. And so her platform she ran on was that there was no covering for the playground and it would get very hot. And so they couldn't touch certain parts of it. And so she got up there and she's like, vote for me. I'm one small cookie. I'll make sure to put a shade over the playground. It was just the most adorable thing. And the parents were just like, adorable, yes, but also she had a very critical point. They could burn themselves and they wanted to play, help us play. And so talk about Shactivist, right?
I'd love to jump in on that one because the Youth Ambassador program that the Healthy Living Matters folks put together several years ago, we ended up loading up for the last 2 sessions. We've had groups of high school kids that are interested in advocacy go to the Texas Capitol with me. And I got to tell you, I can go in and talk to folks about recess and PE and healthy foods and all that all day long. But it was amazing to me how much when I had high school kids and they were scared to be, they were so crazy nervous in the morning when I was training them on how we were going to do this. We talked about it and they were excited, but you could tell they were so nervous because they were going to go into the Capitol and they were going to talk to legislators. And I calmed them down. We had made a lot of appointments for them. They didn't have to do any of that kind of stuff. We set the whole thing up for them. But sure enough, we got in there and the funniest things started happening because usually when you go to the Texas Capitol, you meet with a health advisor or the chief of staff. But as the elected officials were coming by, they would notice, they'd look in and there were these kids talking to their staff, and kids and politicians just go together. They just cling to each other. It's the coolest thing ever. And these state representatives and senators would stop what they were doing, and they come in and they're like, "Hey, what are you doing here? Do you want to take a picture with me? What are you talking about?" And the kids were like, "Recess," and they're like, "I love recess. Let's talk about it." And these kids turned some of the most curmudgeon, obnoxious legislators because they cared enough to show up, and again, they were well coached. They knew what they were doing. And it was, I remember this one young man, he was hilarious. He had to be about 5'2" and a 10th grader. And I mean, literally his hands were shaking as we went into the first office. And as we came out, he was like, "Tim, that was great. Where do we go to the next one?" And we finished our day. He made about 6 different visits, and his pitch got better and better and better each time we were working on it. And by the time we were done, he was like, "Let's go hit like 3 more offices. Let's just go. Come on. I don't care if they know us or not." And he was awesome. And the other kids kind of built on that energy, and they realized they could make a difference. And they marched into those offices. And I'm so upset right now because we had planned on doing this again this session early on, and then we were going to do it again. But unfortunately, with COVID, the Capitol is closed, and they're not even sure how the beginning of session is going to work. So if I can throw a little pitch out here, we've actually got a Healthy Living Matters youth engagement campaign going, where we're asking the kids to put together a 1 to 2 minute video. The kids love doing these TikToks, right? And they love doing the little snippet things, but talking about an issue that's important to them in 1 or 2 minutes, and putting together a little snippet. And we want to put together several of these little videos of the words from the kids. What do the kids care about? What is it from their perspective? And I think, Katie, one of us can share that link to the thing, because we're going to be collecting these videos, and we're hoping that young people from anywhere in the country, I don't care where you are, if you care about youth and childhood obesity and you want kids to be active and healthy, we're trying to pull these things together. And I'm really hopeful that we'll get some creative stuff. But we'll share that link, because unfortunately, again, we can't do it in person. But yeah, they are by far, if you talk about the people that are connected to the issues, it is the kids. And interestingly enough, we also found through one of our board members who runs the Brighter Bites program, that if you start changing the kids' minds about what they should and can't eat, you start changing the parents' minds too. And the parents start going, "Oh, wow, I didn't know you could eat kale like that." And all these cool things that we're teaching the kids in elementary school and junior highs, they start transmitting. But let me just back up a little bit. So that's kind of really at the ground level. But the issue of getting attention, and we were talking about the business community, and we were talking about other things. There are stakeholders in this across the board that a lot of times people don't even think about talking about. I heard somebody mention radio, churches, communities, the YMCA, the local leagues, the soccer leagues and the football leagues, and if you can have safe routes to your park so that kids can walk and bike to soccer practice, I mean, you're adding another 200 calories burned just getting to and from practice. What a great idea. Why, and again, I may be a little bit of an old guy in saying that, and this isn't, I'm not bagging on my parents at all. My parents were wonderful when I was a kid, but if I wanted to play on the soccer team, I had to bike. I had 3 siblings. My parents weren't going to drive me anywhere. So I biked to almost everything that I did when I was a kid. That's kind of the way the world worked back in the 70s. And for whatever reason now, we don't trust kids biking. We're scared about kids. And I get it. There's a lot of fear in the world. But get out there and bike and walk to school, walk to practice, hang out with your friends walking to and from practice or to and from the park. And so that's just kind of the exciting things that we can see happen if we create the system that we want to see happen. But Katie, do you have that link, or can you talk a little bit more about that, the program that we've got with the kids? Because I know you've been distributing it far and wide.
Yes, the link has been shared, Tim, as you were speaking, and it is, as Tim mentioned, a youth advocacy video challenge. So we want to make sure that all youth who want to share their voice are able to submit that video, and the entries will be accepted up till the end of December. So December 28th, I believe, is our deadline for receiving those videos.
Thank you so much for sharing all that information, Tim. we needed you on this broadcast to go from level 10 to level 11 on excitement. So thank you. Before we leave, Raul, what's ahead for Healthy Living Matters in Pasadena? There seems to be a handoff between the county health department, and the city is going to be more involved. What are the next couple of years going to look like? What are your hopes and wishes for the future there?
Well, like I had mentioned before, I'm going to keep championing Healthy Living Matters principles in any way I can. And fortunately, there's been a new development, so I'll be able to actually be consistently there at those meetings when the city takes over the program, to be able to keep contributing and keep them focused, and so they can continue with all the work that's been done in the community with all these organizations, all these stakeholders, and so they can continue to implement a lot of those recommendations, guidelines. And so I am going to definitely be still here, keeping championing that effort as a community resident and community member, to ensure that this definitely is going to be the best city for our youth and our community.
That is so excellent. Thank you so much, Raul and Katy and Tim, as well as Klaus. This has been such an amazing conversation. As a parent, as someone who lives here in Houston in the community, I just love seeing this for this community, and then seeing just the enthusiasm that you all have. And we all know that not every public health initiative develops deep roots. And you all have shown that community involvement is a key agent. It's been a motivator of change and sustainable change in the city of Pasadena. It would have been so easy for the community, the school system, the city, everyone involved, MD Anderson, to say no to this initiative, but instead they said yes and continue to say yes. So thank you so much for showing our viewers that this is possible and giving them a route, just ideas and tips to do that. So we do have a quick survey on YouTube and Facebook where we'd like to get y'all's feedback as well as that of our viewers on the program, as well as many recommendations for future episodes. Please make MyDiabetesHQ Live better by filling out this survey. So it's been a great start to this morning, guys. Thank you so much one last time. To our viewers, we hope that this conversation has encouraged you to consider ways to bend the curve of obesity and diabetes in your tiny communities. Mark your calendars. We will be broadcasting every Saturday, 10 a.m. Central Time and 11 a.m. Eastern. Join us next Saturday, December 12th. Thank you again for being part of the MyDiabetesHQ community. See you next time.